rhinoplasty has become a very specialised operation, a very focused and individual operation. And to that end, no one gets the same operation. We use specific software to create morphs, simulations when we see you, which gives you a clear visualization of how your nose could look. Good morning. Hello, I'm Charles East. I'm a consultant surgeon specialising in facial plastic surgery, and today I want to talk to you about rhinoplasty surgery. This is one of the most commonly sought after operations, and it can be an indication for both functional, for nasal obstruction, aesthetic, a combination of both, or even post-trauma, post-injury, a form of reconstruction. Now, rhinoplasty is a very complex operation, and over the last 30 years I've dedicated the majority of my career to developing, researching and undertaking this operation. And rhinoplasty has changed significantly in recent years. We now, with our research group, have come up with a technique called preservation rhinoplasty. This is a modern way in which we can conserve, reorientate and reposition the nose without taking it to pieces, and therefore needing a reconstruction. This application has proved a very stable and reliable form of technique of surgery. Not everyone is suitable for that type of operation, and so the traditional reconstructive type surgery, which may or may not involve grafts, that is pieces of tissue used to rebuild the nasal frame, may still be required. This is particularly so if you've had a trauma or damage to your nose, or if you're unfortunate to have a primary rhinoplasty which didn't go well and you need to have a secondary repair. Secondary or revision rhinoplasty is a very complex operation indeed, and it does require a high degree of skill. It takes longer to achieve and is really in the realms of what we call a supra specialist. Now, along with rhinoplasty, we also undertake other aspects of facial surgery, and sometimes in combination with the chin. For deviated or asymmetric faces, we can move the chin sideways, forwards if the profile is not correct. Eyelid surgery is often performed with rhinoplasty for drooping eyelids in the upper lids or prominent bags. And of course, facial contouring using surgical techniques such as fat transfer are also employed with rhinoplasty surgery. So overall, this operation is one that may have many indications. It may be that you were born with a nose that you did not like and wish to change it to improve your self-worth and your confidence. This is true particularly for a lot of teenagers. Secondarily, you may have had a trauma or an injury to your nose which caused it to be deviated, blocked, or even the bridge to collapse slightly, and that may require a reconstructive operation. Those reconstructive operations often have a functional element to them as well, and we'll employ modern techniques such as cone beam scanning to assess your nose and your nasal airway. We also employ a skin management program because the skin envelope is very important in this operation. A lot of the swellings and problems that can happen without skin care are avoided by pre-treatment and control, particularly of oil. So overall, rhinoplasty has become a very specialised operation, a very focused and individual operation. And to that end, no one gets the same operation. We use specific software to create morphs, simulations when we see you, which gives you a clear visualisation of how your nose could look. This is incredibly important, and it acts as a vital communication tool, because with all these operations, it's very important that the surgeon and patient build a mutual trust. When that happens and the operation goes ahead, then we're likely to have a very high level of success with a very low risk of needing further treatments. So that summarizes my work at the moment with rhinoplasty surgery.